Salam, everybody, and a very warm welcome. I'm Nadia Bukhari, founder and COO of Siha Health and Wellness, and I will be your host for today's webinar. Quetta Gladiators, in collaboration with Siha, have signed a strategic partnership for the Pakistan Super League. This collaboration will help Quetta Gladiators extend its effort and operations in the health and wellness sector. The partnership between Quetta Gladiators and Siha is the first one of its kind, where the two different organizations have joined hands together for the cross-promotion of sports and the wellness of the society in Pakistan. This is a landmark partnership for the promotion of sports and the wellness of the society, and Quetta Gladiators have always come forward and looked for betterment of Pakistan. We at Siha are proud to be Quetta Gladiators' official wellness partner, not just for the PSL, but beyond too. Physical activity is important for promoting both mental and physical well-being, and of course, playing sports significantly contributes to that. In light of the pandemic, people are now focusing more on their wellness and are becoming more aware of what they need to do to keep healthy. Following our partnership, we have launched a health and wellness webinar series with Quetta Gladiators, addressing the issues around health and wellness in sport and promoting physical well-being. Today is our first episode, and we kickstart the series by looking at sports health, and who better to be our expert guest than Dr. Zaf Iqbal, also dearly known by many as Dr. Zaf. Dr. Zaf is a consultant in sports and exercise medicine and has been involved in a variety of sports and exercise medicine settings in both the NHS and the private sector. His work has been in professional football for the last 17 years, having worked in various leagues in England and within the FA setup. At present, he is working as the head of sports medicine at Crystal Palace FC, and prior to this, he was working for Liverpool Football Club and Tottenham Hotspurs Football Club. He's also the chairman of the Premier League Doctors Group and has been contributing to the education for the next generation of sports medicine specialists at Queen Mary's University Hospital as a senior lecturer. Welcome, Dr. Zaf, and thank you for joining us today. Before we begin our session, I'd like to remind our audience that we welcome your questions. So please do use the comment box for any questions that you may have, and we'll try to answer as many as we can. So let's make a start. Welcome, Dr. Zaf. How are you doing?
Salam. Yes, very well, thank you. Just finished training. It's a little bit cold here, but yeah, looking forward to this.
Well, thank you. Thank you for your time today. So my first question to you, Dr. Zaf, is how do you assess an injured athlete?
Okay, so as with anything in medicine, we start off with a history and to try and find out what actually happened in terms of the injury, when it happened. We're also quite fortunate in professional football, whereby we can also usually review the mechanism on video. So this will give us quite a lot in terms of what actually happened, what the actual mechanism was. Following that, then we'll go on to the examination. So we'll inspect the actual tissue that has been damaged and then palpate it and then look at movements. And this will give us an idea of what structures have been involved. We may then also do some further strength testing and also some functional testing. And after that, we'll get an idea of what our diagnosis possibly is, and we may help support that further by doing some further investigation, such as imaging, such as ultrasound, X-ray, or MRI. By the end of that, we'll have got an idea of what tissue has been involved, what grade that injury is, and then with the rest of the team, we'll then start formulating a plan for the rehabilitation of that.
Okay, so yeah, so it's quite an extensive process. And what advice would you give to anyone who has injured themselves whilst playing sport?
So the first thing, and this is the same for anybody that gets injured, is making sure that you get the correct diagnosis. But even before that, so if you're, say, playing amateur sports and you injure yourself, say you turn over your ankle, it's really important that what you do immediately after the injury. Quite often we find that people don't manage their initial injuries well. And so by the time that they've actually gone to see a healthcare professional, they'll have quite a lot of swelling, and that makes the diagnosis and also the further assessment and rehabilitation that bit more difficult. So the first advice that I would give for anybody playing sports is that if you do get injured, then there's an acronym called PRICE. So protect the actual joint. So stop doing what you're actually doing, rest it, apply ice. So anytime you get any injury, always put ice on straight away. Sometimes you hear of people putting heat on or even haldi on, but I would certainly recommend that you put ice on, and you should do that for about 15-20 minutes for the first 2 days, every 4 to 6 hours. Also try and elevate the injured area. And the main reason for that is to try and reduce the swelling as much as possible. By doing that, it'll allow the healthcare professional to assess the affected area that much quicker. So in summary, anytime you get an injury, the first thing that you should do is rest and apply ice 4 times a day at least for 2 days.
Okay, that's really great advice. So what about what's your views on having doodh haldi?
Look, in terms of it, it's quite funny in terms of haldi. We're actually giving that to our players because there is now quite a lot of evidence that turmeric does have good anti-inflammatory effect. And the ironic thing is, I used to, when my mom used to recommend haldi for almost every injury known, I would sort of like just laugh, and I just wish I'd listened to her, because I'd be a very rich man by now. Because if you see some of the supplements with turmeric and haldi that are coming out, somebody's making quite a lot of money.
Oh, absolutely, absolutely. So obviously we saw just recently in the T20 World Cup series, one of our national treasures and assets, injured himself whilst bowling. So how do you know if an athlete is safe to rejoin their sport and play for their team again once they are, injured?
Good question, because it's always a battle between ourselves and the management and also the player. So this goes across any sport, because the athlete wants to get back after an injury as soon as possible. Nobody likes being in the gym doing rehabilitation, spending time with the physios and doctors. So we've got to try and give as much confidence back to the player, and also rationalize to the coaching staff why a player may not quite be ready, or conversely, a player may be ready. So first of all, it comes down to the clinical tests that we do in the bed, making sure that they're not getting any symptoms while they're on the bed. Next, it'll be about functional tests. So in terms of, there'll be certain movements that we'll do, and again, those have got to be pain-free. We then move on to strength markers and testing. So we'll have certain equipment which allows us to give objective data in terms of whether their strength has returned back to what the normal level was. Then we move on to the work that they're actually doing on the pitch. So whether that's as a footballer in terms of running, or whether as a bowler in terms of their bowling and speed. So what we'll do is we'll gradually build up that volume and make sure that the amount of work that they've done in the rehabilitation, it's similar to what they would be doing in a training session, so that when they go into a training session, which is going to be uncontrolled, then at least we're confident that they've actually done a similar amount of load. Of course, nothing can replace match scenarios where ultimately that's where they're going to be performing at their peak, and it's going to be very much uncontrolled. So again, we look at trying to get as much training load in, so that again we can give the player confidence that they're ready to be involved in a match scenario.
And that's a lot of pressure, though, isn't it, Dr. Zaf? Because, and I'm just drawing from the example that we've recently had in the T20 World Cup series as well, where, the nation's hopes, are for the team, and that, everyone wants their team to win. And, your golden, your key player has been injured, and you could tell, at that point, Shaheen Afridi as well, he was really wanting to come back on again. Yeah, how do you take that call?
I'm not going to speak about specific players, if that's okay. But in general, no, sure. In general, I think it's the same, that what we try and do as much as possible is be as objective as possible. So we do lots of screening before a player is injured. So we do lots of testing in terms of strength. There's certain devices such as IKD where we're able to get good objective strength data on lower limb. And also we use the GPS a lot, which allows us to measure how much somebody's run, what speed they're running. So we get a good idea in terms of, from that data collection, what they were like before injury. So what we then do is make sure in their rehabilitation process, they've got to hit all those clearance markers, and they've got to get back to as close as possible within 10% of their pre-injury levels. Because we know if they're not within 10%, that just then increases the risk of re-injury, and that obviously is a disaster for everyone. So in terms of when we get a player back, of course, the manager is always desperate to get the player back as soon as possible. We present the data to them and say, look, this is what they've completed, and it's all about risk reward. So listen, if you know, in the footballers that we have, there's very rarely a player is back and they're at 100%. The question then comes down to what is the risk compared with the reward of a player coming back and they're not 100%. They're always continually carrying some sort of little niggle or little issue, and we've got to give the player as much confidence as possible that actually, despite that, they're able to perform and they're not. There's no point having a person there in body if they're not able to perform. So ultimately, that's what it comes down to. So we have a lot of performance markers which we use to give to the player and the coaching staff and say, look, this is what they're hitting, and the decision is theirs ultimately.
Okay, that's very tough decisions, but it's great to hear that there are actually, you know, robust systems in place to ensure, you know, the physical wellness and health of players. So there are excessive sports events going on, as we know, the T20 series, the World Cup has just happened. We've got the FIFA World Cup happening as we speak. PSL is fast approaching. What's your expert advice on how players should maintain their fitness, especially with, you know, our treasured fast bowlers? Should they be consistently practicing to maintain their form?
So look, we also in football as well, especially around this time, especially winter, I don't think there's any medical team, you know, working the Premier League or any other league that really enjoys the winter period, because we have lots of games that are close together, and that puts a lot of pressure. Because the main issue that arises is not so much the actual playing, is whether they've recovered enough in time for the next session or game. And so that's where the problems really arise. What we find is that if a athlete has been training consistently and regularly, then what happens is that their risk of injury reduces. So if they've been training regularly and consistently for 4 weeks at least, then we know that their risk of injury is relatively low. Where you have a problem is if somebody just comes in and suddenly their load increases, and they've not been doing a huge amount of training, and then suddenly they have an increase in their load, whether that be bowling load or as in football where they've been doing lots of running. That's where they're going to pick up injuries. Equally, we know that if somebody does too much training or does too much load and they don't have enough time to recover for the next session, then they're also going to be at risk of injury. So that's why we try and collect a lot of GPS data and as much data as possible to try and show that actually whether somebody has done too much or too little. And you might have heard of figures such as, you know, somebody being in the red zone. And what that really means is that they may have done a bit too much work. And so going into a game, we may need to tailor that down a little bit so that they actually go into a game as fresh as possible. There's no point them going into a game or a training session where they're tired, because ultimately they're not going to be able to perform. So we have to get what we call the periodization right, where you need to get enough work into them where they're getting a stimulus and they're able to cope with the load, but not too much, especially close to the game, whereby they're going to be fatigued and tired, which is going to put them at increased risk of injury. So essentially, they need to be doing consistent training load, whether that be bowling, kicking, running. That needs to be pretty consistent, and that's only possible if they record their data, you know, and they can actually monitor that.
Okay, that's very interesting. And we're talking a lot about, you know, what to do once following someone's had an injury. But how can someone actually reduce the risk of getting injured once they're playing sport or, you know, training at the gym?
So again, there's lots of data that is out there regarding how we can try and reduce risk of injury. And one of the main things is making sure that you're actually prepared as best as possible for whichever sport that you're playing. So one way is making sure that the amount of training that you're doing is preparing you right for the game itself. So there's no point playing a 90-minute game if your training sessions have only prepared you for, say, 20 minutes or 30 minutes. Obviously, that's going to put you at a higher risk of injury. Going into any training or game, you want to make sure that you're not carrying any current injuries, you haven't got any current problems, and that you've been assessed by the doctor and physio and that they've cleared you to play. Making sure that going into a training session, again, that you've done the right type of warm-up, also pre-activation, which is specific exercises to get you right for a particular session. Certain sports, you may have to wear the right type of equipment. Also playing sensibly during the actual sport itself. And then in any sport, you want to try and make yourself as fitter, as stronger as possible. So we also make sure that all our athletes do regular training and gym work as well. Because, by making yourself more robust, more stronger, and being able to move right, that's also going to reduce the risk of injuries as well. And then finally, making sure that you have good nutrition and good recovery after a training session as well, because then that will prepare you quicker and faster for the next training or game session.
Okay, thank you for that. And, staying on the topic of injuries, we're seeing a lot of criticism of head injuries with possible concussion in the World Cup. How are head injuries meant to be managed in sport?
Look, we see this in football quite a bit, and as often we see it, and it is a very difficult scenario because what we see on the bench may not necessarily be what we see, live or should I say on replays. So I do sometimes have some sympathy with our medical staff, because by the time they've actually got to the player, the way that the player may be presenting will be very different to what everybody else is seeing on TV. But look, what we're told, and as healthcare professionals, if there is any doubt with regards to concussion, any doubt, we've got to sit them out. And so what we do is we're meant to do a full assessment on the pitch side to see if there's any evidence or signs of concussion. Again, we're quite lucky in football whereby one of the physios will also have a tablet where they can see replays and have a look if there are any signs of concussion. When the actual athlete fell, how they fell, did they control their fall? And then we ask them a series of questions. And again, the whole purpose of this is to see if there's any evidence of any concussion. If there is any evidence of concussion, and concussion doesn't mean that the person has to be knocked out. It's basically any blow to the head or force that is transmitted to the brain, which can result in a temporary neurological deficit. So what we have to do is do a quick assessment and see if there are any signs of concussion. And sometimes that may not present straight away. The easiest scenarios is when somebody has been knocked out, then there's no doubts there and you can easily take that person off. But again, go back to, if there's any signs of concussion, we're meant to take them off, and then they go through a strict 6-stage program whereby they rest for a certain period of time, and then they gradually increase their activity and make sure that there are no symptoms at each stage. And so that can vary depending on whether you're in what we call an enhanced environment, like we are in the Premier League, whereby a player may be able to return at 7 days, 6 to 7 days, which is at the earliest. Or if you're not in an enhanced, you're meant to rest for 14 days, and then the player may return at about 23 days post concussion. So as I say, we've got to take this seriously, and sometimes, as I say, unfortunately, it can become very difficult because you're in the game scenario. The player can be quite resistant. The manager may have his own ideas, but ultimately, it is meant to be the doctor's decision. And if the doctor has got any suspicion of concussion, then they should be taking them off the pitch and they should be out of the game.
Okay, a lot of responsibility there. So we'll head towards some audience questions, if that's okay, Dr. Zaf. Sure. So one I've got here is, when is the best time to eat, and what do you recommend before playing sport?
Okay. So in football and in quite a lot of the sports where there is some activity, certainly for 60 minutes plus, we recommend that you eat between 3 to 3.5 hours before the game or the sport. And the main reason for that is so that the food is going to be digested and used. Otherwise, if the blood is being used to digest the food, then you're not going to have as much blood going to the muscles. So you're going to fatigue that a little bit quicker. So our pre-match meal is usually, as I said, it's about 3.5 hours before the game, and that usually consists of quick release carbohydrates and a little bit of protein, but mainly quick release carbohydrates. So something like grilled salmon, chicken, pasta, sweet potatoes, cereals, which will release energy slowly. You don't want any heavy foods, dare I say it, such as curries and steak, because unfortunately that will take a lot longer to get absorbed.
Okay, very interesting. And the next question here is, what does a swelling in a joint mean?
Okay, so swelling in a joint can be due to a variety of reasons, and really we need to investigate what the cause of that swelling is. So it can either be due to trauma, so somebody may have had a twisting injury or a direct impact, and we've got to make sure that there isn't bleeding within the joint. The other thing that can happen is that the actual capsule, which is within a joint, that can get inflamed as a result of a twisting injury or trauma. And so you can get excessive synovial fluid being produced, which can also make the joint swell up. What that will do is it'll cause discomfort. It'll also make that joint much more stiffer. And so certainly if the fluid, if there is swelling within a joint, it really needs to be assessed, and that swelling needs to be reduced before you return to sport. The main reason is if you try and continue playing with a swollen joint, you're going to put yourself more at risk, not only of that joint, because now the joint can't move as normal, and also you lose something what we call proprioception, which is balance, as a result of the swollen joint. So first and foremost, you need to find out what the cause of the swelling is, and then you need to reduce the swelling and before you actually return back to sport.
Okay, thank you for that. Our next question here is, how soon can someone exercise after an illness, for example, if they've had COVID?
So our understanding, certainly with regards to illnesses such as COVID, has changed quite a bit. So when we first started out with some of our footballers getting COVID, first thing is making sure that they've recovered from that. Nobody should be playing if they're still getting symptoms. And if they've had prolonged symptoms, then they need further investigation. So when we first started out in football and with the COVID scenario, every player that had COVID, we would wait till their symptoms had settled. Then we'd also do some blood tests just to make sure that the inflammatory markers had come down. We'd also do some heart screening as well, because early doors, there was some suggestions that as a result of COVID, that people can have an increased risk of something called myocarditis, which is inflammation around the heart. So we needed to make sure that our athletes were completely clear before returning. And if we're talking about any illness, not just now COVID, what we do is we will use heart rate monitors, and we'll do something called a basic fitness test on a bike, whereby they'll do a 5-minute time trial on a bike, and we'll check their heart response and make sure it's not more elevated than normal. And this is a quick and easy measurement of fitness and fatigue, and it just allows us and also gives the player confidence before they return to training that actually they're able to cope with some sort of cardiovascular training. If we're finding that their heart rate is way above what it normally should be, then we say that actually it probably is sensible that they don't return to training just yet and give them more time to recover.
Okay, thank you for that. Our next question is, what can you do to help recover quicker after playing sport?
There's quite a lot that can be done, and again, over the years, this has evolved. So it doesn't matter if you're Messi, Ronaldo, or one of the best cricketers. This goes for any sport really. So immediately after the game, we usually have a set pattern that every athlete will do. So we make sure we get some fluid on board. we'll give them something like tart cherry juice, because that has been shown to help with the recovery and also sleep. We'll give them a recovery drink, which will contain some carbohydrate, because you want to replace some of the carbohydrate that has been lost in the muscles, but also some protein as well. And what the protein does, it helps regeneration of the muscle that has been used, and repair of that. You'll see some people also going into cold baths, ice baths, and that again has been shown to actually help with the recovery. One of the theories is that it helps reduce some of the inflammation that occurs as a result of playing sport. Making sure that they have a good meal immediately within 30 minutes that contains some protein and carbohydrate. That's probably the only time that we do allow people to have something like pizzas, potato, chips even, and burgers, because you just want to replace the carbohydrate and protein as quick as possible. And then some will have compression tights, and again, that helps with regards to reducing the DOMS and tightness that occurs after activity.
So with that cherry juice you said, that's the first I've heard of that.
Yeah, so tart cherry juice, there is some evidence that it has been shown to help with regards to recovery, and also helps with regards to sleep as well.
Wow. Okay. Well, better go and get myself some cherry juice. And my next question here is, can you name some training that can help boost endurance whilst playing in hot, humid climates?
Okay. So it all depends in terms of what kind of sport that you're actually doing, because what we say is train as you play. So whenever you're doing any sort of training, it's got to be similar or close to the kind of sport that you're playing. There's no point doing one type of training which is not going to really help you or benefit you in your sport itself. So in football, for example, if you want to get fitter in football, then what we normally recommend, and all our players in the off season will be given programs which will consist of endurance running. So it'll be a combination of sprint running and also endurance running, and just basically doing lots of drills around that. And it can be the same in cricket as well, because we know in cricket there's going to be lots of running between the wickets. So again, if you're playing cricket, then just practice that after a game or a training session. Just put in a couple of drills whereby you'll do 10 or 20 shuttles between the wickets. So that, again, if you get into that routine, it's just some additional work. It just builds up your fitness that way. So it's really specific to your own sport. Have a look at what your sport is, what kind of drills or skills that you're required for that sport, and just try and do some more of them, and just try and increase the not only the speed but also the duration and the frequency of those, and that's how you usually build up your fitness that way.
Okay, great. In your experience, obviously you've got extensive experience, within the football sector, and you're seeing players day in, day out. How do you support the sort of mental well-being of your athletes?
So a combination of things. So we will use a psychologist or a psychiatrist as and when required. So there's two parts to this. So one is from the performance side, and then the other aspect is really looking at it from, they're no different to any other people in society. They all have their problems at home. They'll have their problems with regards to finances or whatever. So from a mental health perspective, in terms of depression, anxiety, that's also got to be assessed. So being a doctor, I'll probably look at more in terms of that side, in terms of depression, anxiety, and see if there is ways that we can support them, or if they need further assessment by a psychiatrist to help them on that front. With regards to performance, that's a different aspect, and sometimes that can be helped by the coach, who will try and give the player confidence. We try and give players confidence from the injury aspect. Just as we mentioned earlier, that we do lots of testing and screening, we'll give them confidence by showing, actually, this is how much work you've done, this is how much strength training you've done, this is how strong you are. Because if they're anxious about returning, we can actually give them confidence in that way by saying, look, this is how much you've done. So compared with what you're going to be expected to do, you've actually hit those targets, so you should be okay. In terms of actually performing, then that's where a coach comes in, and sometimes they may have a psychologist on board who can try and answer some of their anxiety. So, for example, playing a particular shot or taking a penalty. That's where sometimes the psychologist or the coach themselves may be able to help them and talk them through in terms of how to focus and how to best work through a particular skill.
Okay, thank you for that. Final few questions now. At what age can we put a child into sport or physical training? My son is now 5, and how soon can I get him to start playing sports, and how much time in the day should he be allocating to this?
Listen, kids are quite resilient, and there's absolutely no reason why they can't. As soon as they can walk and run around, it's entirely up to them, as long as it's a safe environment. The most important thing is that they should be enjoying it. No kid should be forced to be playing sport, and they should be enjoying it. And the kid will let you know if they're doing too much. And I've yet to meet a kid who's enjoying the sport that says that this is too much for me. So whatever sport, get them to do as much as possible. If you look at a lot of the the elite athletes, they're playing from the age of 2, 3, so they're picking up their neuromuscular control and skills from a very, very young age. And as I said, kids are very resilient. They can pick up skills very quickly. They can pick up languages very quickly. So they can absorb quite a lot. Most important thing is that they're enjoying it, and just let them go and have fun.
Okay, and Dr. Zaf, it seems like you have inspired and motivated some of our audience today. So our last question here is, how can I get into sports medicine?
So the first thing is getting into medicine, which is probably the hardest bit to start off with. So getting into medical school, becoming a doctor, and then after that, you can then specialize in sports medicine if you wish. And so as I say, I've been working now in the last 17 years in sports medicine. I'm always constantly learning. I'm quite fortunate. I love sport, and I've been able to combine my two passions of sport and medicine. So yeah, first thing is get into medicine, and then you can find out a little bit more about sports.
Well, thank you for that, Dr. Zaf. That's now the end of our questions and the end of our webinar as well. I'd like to just thank you, firstly, for your time, and secondly, for such an informative session. I mean, I've learned lots today, and I'm seeing from the comments as well, the audience have been very appreciative of everything that you shared with us today. So thank you so much for joining us. Please, audience, do keep an eye out on the Quetta Gladiators social media pages for our next episode of our webinar series. We'll be looking at a variety of things such as mental health, physical health, nutrition, all to do with sport. And you have been a great audience, and I look forward to seeing you all again soon. Long live cricket, #Purple Force, long live Pakistan. Thank you.
Thank you.